and there is nothing much to discuss because the speakers, we have discussed about the clinical features, the way the disease is spread, the prevention, the treatment. They have given a very nice elaboration about this disease. But especially I like to thank the performers over here, the street performers, who has done so nicely. They have shown the way how the disease spreads, because we know that prevention is better than cure. So we need to prevent. How to prevent the disease? So they have shown us how we can prevent the disease by not using a common needle, by not using a common shaver, by using protective sex behaviors. So these are the things we should keep in our mind, because we are health workers. You, the nurses, the laboratory technicians, we, the doctors, we are exposed to this risk every day, every time. Whenever we give an IV injection, we do not know the status of the patient without knowing the HIV status, because we know that when we get the virus inside our body, for first few months or even few years may pass by when we do not have any symptoms. Our previous speakers, they have said like this. So for the first few years, we may not have any symptoms, we may not show any features of HIV, or we may not have any we may not have any features of HIV. So during that period, when our blood is contaminated, so we may get this infection, we may transmit this infection to the other person. So we have to take care during our nursing procedures, during our technical procedures. So whenever we have a doubt that we have a pinprick or a needle prick, especially our nurses, they are exposed to this risk every day. So whenever they have this pinprick, our last speaker, she has nicely told that we should go for the post-exposure prophylaxis. Now the question comes, where do we get this post-exposure prophylaxis? This is available in Messenger Medical College in the Department of Casualty. So whenever you have a doubt that the patient with whom you have encountered, he or she might be having the disease, so we have to take the proper history. Then if we think that we are at risk, we should immediately go to the post-exposure prophylaxis center, and we have to take the drug so as to prevent further multiplication of the virus. If we can take proper precautions during that period, I think we can prevent. And rest, like to use protective sex, then to use needles, not to share needles, to use new needles, all these are discussed. The treatment part they have discussed is so nicely, but once again I should thank the performers over here. They have shown us, they have illustrated everything so nicely. So another round of applause for those performers over here. So once again, thanking you. Take care of yourself, serve the humanity, and HIV virus is preventable, though it's not curable. So we should try to prevent. And those who are suffering from the disease, we should not neglect them. They are a part of our society. We should include them in everything, because sitting with them, talking with them, sharing food with them will not cause the transmission of the disease. So they are a part of our society. They are like us. So we should not segregate them. That should be our motto. Thank you so much.
Thank you, sir, for such a valuable words. Everyone from the front to the back, a huge round of applause for our chief guest, come chief speaker.